क्या आपको पता है कि टेस्टोस्टेरोन थेरेपी के फायदे सिर्फ मसल और एनर्जी तक ही सीमित नहीं होते हैं। आज हम बात करेंगे एक ऐसे सवाल पर जो बहुत ही कॉमनली यूज किया जाता है, दैट इज क्या टेस्टोस्टेरोन थेरेपी से फर्टिलिटी भी इंप्रूव हो सकती है। हेलो फ्रेंड्स, आई एम डॉक्टर स्वप्निल टोपले, कंसल्टेंट यूरोलॉजिस्ट एंड एंड्रोलॉजिस्ट। सो लेट अस अंडरस्टैंड द टेस्टोस्टेरोन थेरेपी। ये क्या होता है? So, testosterone therapy involves the administration of synthetic testosterone to treat low testosterone level in the men. This can be done through injection, patches, gels, or implants. It commonly used to address symptoms of testosterone deficiency such as low energy, reduced muscle mass, decreased libido. So, what is the role of testosterone in male fertility? So, testosterone plays a crucial role in male reproductive health. It regulates the production of sperms, the development of male reproductive tissues, and the maintenance of libido. So, adequate testosterone levels are essential for normal spermatogenesis also, that is sperm production. How testosterone therapy works? So, testosterone therapy aims to restore the normal testosterone levels in the men with a low testosterone, which is documented. This can alleviate symptoms associated with the testosterone deficiency and improve the overall quality of life. However, the impact of testosterone therapy on fertility is complex and multifaceted. So, effect of testosterone therapy on sperm production. Let's talk on that. Paradoxically, while testosterone is vital for sperm production, exogenous testosterone that is administered through the therapy can suppress body's natural production, the sperms, and thereby spermatogenesis. This is because the body reduces its own testosterone production in response to the external supply, leading to lower sperm counts and potentially affecting the fertility. So, what are the potential benefits of testosterone therapy? One is increased energy and vitality. Secondly, enhanced libido. That is, improved testosterone levels can boost the sexual desire and performance. Third is improved muscle mass and strength. Testosterone therapy can help increase the muscle mass and the strength. But there are certain risks associated with the testosterone therapy. One is reduced sperm production, as mentioned earlier. Testosterone therapy, which is injected exogenously, can reduce the natural testosterone and thereby decreasing the sperm count. Second is infertility. Prolonged use of the testosterone therapy can lead to infertility due to suppressed spermatogenesis. The other side effects could be acne, sleep apnea, increased risk of cardiovascular issues. So, importance of medical consultation before starting testosterone therapy is very important, because your urologist or the andrologist can assess your medical history, assess the hormone levels by doing certain tests, and also assess the fertility goals. In cases where fertility is a concern, alternative treatments or strategies can be adopted. It can also pose significant risk to the fertility also. So, consulting with a medical professional which can make an informed decision to find the best approach to meet your health and fertility needs. Thank you.